Hello again, I'm Dr. Brian Hulsey from Foundations Chiropractic in Lake Oswego, Oregon. We have been doing a series on thyroid hormone metabolism, and I wanted to continue on with our series. So currently we've talked about thyroid tests that should be ordered, as well as thyroid tests that are commonly ordered in common medical practice. We went through thyroid hormone metabolism from brain interaction with the thyroid to the liver into the gut, as well as the beginning of hormone interactions with thyroid. So we briefly discussed last time, our last video, about estrogen and testosterone and how that can impact thyroid binding globulin. Again, you might want to reference our last video that we did there. Estrogen is going to cause an increase in thyroid binding globulin, effectively decreasing free thyroid hormone. Testosterone is going to do the opposite. Very common with this is blood sugar irregulation in both males and females, liver clearance issues, so all this needs to be looked at. We're going to get into a little bit more about hormone interplay with thyroid. Today we're going to get through cortisol as well as progesterone and its impacts on thyroid metabolism. So our second thing I want to look at here is cortisol surges. So cortisol surges come from stress. What is stress? Stress can be thought of as any change from normal physiology or function. So that's anything. So we have blood sugar that goes up and down after we eat. If we're tired after we eat, that could be an indication of insulin resistance. That's a stressor on the system. There's too much insulin, that's going to drive up and drive blood sugars down. We need to have a healthy adrenal system for a cortisol response to increase blood sugar to give us at a stable level there. So that is a stressor, as well as hypoglycemia. So blood sugar issues are definitely an issue because of fuel. We need fuel for all of our cells to function properly. 30% of this fuel goes to our brain and nervous system. So if any of you are experiencing dizziness, vertigo, chronic pain, fatigue, depression, weight gain, so some of these things could be coming from brain function, but we can't have a neurologic issue without having a metabolic issue. Another thing that could impact or could be a stress is anemia. So anemia is also played into fuel delivery. This is going to decrease our body's capability to carry oxygen throughout the tissue. So oxygen is one of those things that also is needed to help increase cell energy or cell fuel. So it helps the mitochondria, which are the little furnaces in our cell, help produce ATP, which is our cellular energy. Leaky gut. And leaky gut could come from gut bugs, parasites, bacteria, yeast that shouldn't be there. We should have enough good guys to combat the bad guys. And think of it as a hotel. If all of our rooms are filled up with good guys, then the bad guys can't come in and take up space. So we need a healthy amount of probiotics. Again, we need to test for these things. It could be food issues, commonly gluten, dairy, soy, egg, corn, any of these things that can cause increased inflammation in the gut. Most of our immune system lines the small intestine. Probably about 80% of our immune system is in the small intestine. So if we have issues with those foods and are creating constant inflammation, which is a byproduct of immune system activation or stimulation, inflammation, think of that as swelling. We can have swelling throughout our body. So if we have swelling on the brain, this could cause brain fog or fatigue, again, chronic pain. It can cause issues with focus in our children. It can cause issues with staying or keeping under control. Irritability. So a lot of these things can be related to food and leaky gut. So again, we need to check for that because it's a stressor. We've already talked about the liver and its involvement with thyroid hormone metabolism because it is our main place where we get conversion of T4 to T3. Remember, T3 is the most active thyroid hormone. So if we are taking a lot of prescription medications or a lot of over-the-counter medications to help with our pain, that definitely can be a strain on liver function. So food can also be one of the first signs of celiac disease, could be prolonged elevated liver enzymes. So that definitely can be an issue. Artificial sweeteners, they are finding that artificial sweeteners act as a drug and they're processed the same way. So we have two main pathways which our body can detox substances. We have phase one, with imagine bagging up your garbage, and phase two is taking the garbage out. So a lot of people have compromised phase two systems, so we get an increase in toxic material or toxic buildup that can cause issues here too. So if we have altered liver function, this is going to be an issue with increasing cholesterol. It could be an issue with converting thyroid hormone. It's going to be an issue with blood sugar regulation. So all of these can be different stressors on the body. All of them need to be looked at. We can have immune imbalances. We talked about in inflammation with leaky gut and immune system activation, so we can get a teeter-totter effect with the immune system. If we have too much activation of the immune system, now we can start going after our own tissue. And so the immune system needs to be kept in balance, because if it's not, again, we can go after our own tissue. One of the most popular tissues that the immune system likes to go after is thyroid gland. So that can be an issue. I'm sure a lot of you have heard of autoimmune conditions such as rheumatoid arthritis or lupus. Thyroid problems, especially hypothyroid, actually all graves, hyperthyroid, are considered autoimmune issues. So we need to check the immune system. Hormone imbalances, like we talked about with estrogen and testosterone. We're going to get into progesterone a little bit more, but cortisol is a big one. There's the list can go on and on as far as what's considered a stressor. But remember, a stress is any change from normal physiology. So I've identified some chemical stressors, as well as we've talked about some physical and emotional stressors that can play into it as well. So physical and emotional stress, we could be dealing with chronic pain, or a bad situation with husband, wife, stress with kids acting out. Who knows? I mean, the list goes on and on as what can be a stressor, but all of that is going to have impact on thyroid metabolism. Again, I'm Dr. Brian Hulsey of Foundations Chiropractic in Lake Oswego, Oregon. I hope you're enjoying the series on thyroid hormone metabolism. Our next video we're going to cover is the actual impacts of increased cortisol or too much cortisol on the thyroid system, as well as the impacts of progesterone. Stay tuned and have a good day.